Hello everyone. We come across a lot of patients coming with blood vomiting or blood stained vomiting. Now these are very serious problems which unfortunately people take it very lightly. Sometimes there is a little bleeding which is sort of a warning sign, and there is a lot of blood which is collected in the stomach which comes on later. So अगर थोड़ा सा भी bleeding आपको हुआ है तो immediately you have to seek consultation of at least a doctor, if not a gastroenterologist, who will finally guide them to us. So when we see this patient with blood vomiting, what we do is immediately check his vitals, see if the patient is stable enough, and then go ahead and do an endoscopy. Most of the times, I would say 90% of the time, we are able to find the cause of the blood vomiting, and the same can be treated with the endoscopy in the same sitting. Very rarely we get very severe bleeding where the patient has come in a state of shock. We have to admit these patients in ICU and they have to be intubated and then do the endoscopy in an ICU setup where, because the patients are very, very critical. I would say that 90 to 95% of the patients can be controlled. Their bleeding can be controlled with endoscope itself, and very, very rarely they do the required surgery. So my humble request to all the general practitioners as well as people in general, that whenever you see a patient with blood vomiting, please, for God's sake, rush him to the hospital immediately, because it's a very, very serious problem. And as I said, 95% of the patients can be salvaged. Thank you so much.